so critical to the success of our patients. So with that, I'm going to go on mute and off camera, and I am going to turn it over to Kenlyn. So Kenlyn, take it away.
Thanks, Kim, and thanks everybody for allowing me to be a part of this session and your growth, your journey of growth. It's really exciting to be able to talk about care management, which is one of my passions. And so we'll just kind of launch in. If you'll advance my slide, please. Thank you. So the main thing I wanted to make sure that we really started talking about today, this morning, is how, as a hospital and with your role within the hospital, because that's where I'm based, is inpatient comprehensive care management or case management, is really the strength that we have when we work together. That our unity is our strength and our collaboration is our power. So I just want to kind of touch on at first some of the challenges that come if you isolate yourself, because my hope is that in this first part of our conversation, I really encourage you, if you haven't already reached out to your case management leader on your campus, that you do so. And if you are reaching out, that you really work to continue to establish that collaborative relationship, because my experience over my years of leadership and working in, as Kim mentioned, different hospitals within my organization and different regions within my organization, I've always found that when it's time to pull up a seat at the table, I always want to sit next to my quality partner or my quality director partner, because we have a lot of connectivity and a lot of alignment in the work that we're doing. So just to talk about the power that comes with collaboration is to remind people that no man is an island, right? If we isolate ourselves, if we really work to stay within our silo or keep ourselves in our office to work, we encounter a lot of different challenges. And myself, I can reflect back on the hard parts of my career, or the areas or the time frames when, man, work was really a big challenge for me at this time. And what were the things that went on, and what was I doing, or a lot of times what was I not doing? And when I look back at those areas, and they came with growth, because it took some introspection to look at how we could, or how I could, improve in the work that I'm doing. And it really came down to, was I reaching out to the other leaders in my hospital? Was I collaborating with my quality director? And a lot of times that was opportunity for me to improve upon. And so I've, in my own career, learned that by having that collaboration, you eliminate inefficiencies. You stop finding yourself recreating the wheel or chasing down a rabbit hole that maybe my quality partner has already dug into and already has access to. It also limits your innovation and creativity, right? We know that two heads are better than one, and so I have always found that in facing a challenge or being assigned a new project or initiative to launch for the hospital, sometimes my creative juices aren't flowing, and I reach out to my quality director, and vice versa, so that we can work together just to ensure that we're looking at the challenge holistically and bringing in our various levels of expertise and knowledge, so that we can truly form a more well-rounded plan of attack. We know that by siloing ourselves, we decrease engagement and morale, not only within our employees, but like I said earlier, when I look at my own career, when I kind of found some dry spells, that was the outcome of being siloed or separating myself from engaging with others and collaborating. And then it really impacts our patients, right? I feel like as we talk a little bit more, I'll be able to highlight how the collaboration between quality and case management is so intricate. In my building, my quality department doesn't have a lot of purposeful face-to-face interactions with our patients, where my case management team does, whether that's in the daily work that they're doing as they're meeting with patients and planning for transition care, or even in our multidisciplinary rounds with the team each morning as we talk about the plan for the day and the plan for the day for patients. We identify opportunities or areas of concern, and we can bring that back to our quality partners. So I want to encourage you to foster that culture of partnership, to get to know that person as an individual, and to really establish that collaborative relationship, because I have found that it not only impacts me positively on a personal level, but very much so from a professional level, and it's really helped me be able to continue to grow and meet some of my professional goals. So be empowered, because if you are reaching out, the collaboration will come, I promise. On the next slide, I think I highlighted just how quality and case management together is a winning team. In a lot of different areas that we have similar touches related to value-based care and value-based purchasing. So you can see here, I hit on about 6 different areas: hospital mortality, preventable readmissions, inpatient experiences, and like I said, we were talking about how the case management team really has that close touch to patients through the MDR process, our multidisciplinary rounds, and looking at patients in our length of stay conversations or our complex case conversations. And so oftentimes as we're doing case discussions and working through barriers that are keeping our patients here for longer times, we identify quality issues that we need to bring our quality team in on. True with readmissions, I know that in my 2 regions of areas, there's a lot of work being done focused on readmissions, and a piece of that is looking at patients who are coming back from post-acute care providers. And part of the work that we do is partner with our quality team to look at what's being offered in our community and how we as the hospital can break down those walls of the hospital and reach across the street sometimes to these providers and look to see how we might be able to help them improve their services, because in the end we know it's impacting our patients and the quality of care that they're receiving and what we can offer them after their hospitalization, and that's always a positive win. We look at just our patient safety initiatives and looking at our behavioral health patients. I've sat on several task forces that have been led by our patient safety officers out of the quality department as we look at how to better manage and support the needs of our mental health patients and behavioral health patients while they're here in our hospital. And then wearing that regulatory hat, our quality team in my regions wear that. And so we look at just the contracts that we have with some external providers, whether it's EMS or our GIP hospice providers, to ensure that as we have different companies acting as an extension of our healthcare system, that we're able to get their data, help hold them accountable, understand where there may be gaps, and help identify solutions for those things. So I'm going to look at my notes over here because I wanted to make sure to highlight that collaboration between case management and quality really provides the quality team with a patient-facing partner that is intimately involved in patient care, particularly during those critical transitions of care, which I touched on, talking about whether it was patients who had transitioned out of the hospital to a post-acute level of care, or even those patients that we were encountering barriers with as we were planning and working to get them discharged from the hospital. I feel like case management really has a unique involvement that offers the quality team a frontline expert who's going to understand the process for the entire care team. We don't just identify key areas or issues for readmission, but we're also focusing on patient safety. So sometimes my team will come to me because not necessarily they're encountering issues related to barriers to discharge, but sometimes there's concerns about the course of the patient's journey through the continuum of care and concerns they've had for bad outcomes from procedures or bad experiences that the patient has shared with them. And that is one of the things that we routinely bring back to our quality department and raise a flag. I worked at a much larger hospital within Baylor Scott & White in the beginning of my career, and during that time, we had a very robust quality department that had the ability to travel around to our different multidisciplinary rounds on each unit and listen in on the challenges. That even happened just once or twice a week, because we had so many floors for them to go and visit. It was impossible for them to come every day. But by having that connection as a frontline team member and understanding what the role of that quality partner was, and even just knowing who that person was really impactful to me as a young social worker new in the field, because I knew that if there were concerns or issues related to the quality of care that the patient was receiving, I could reach out to that individual and say, hey, I have a concern. I didn't necessarily have to go through my director so that she could talk to their director and then get back to that person. So one encouragement I would have for you all is, if you haven't yet had some kind of social collaboration between your quality team and your case management team, to consider what that might look like in your building and how that might impact not only the work that your team does, but also case management. Because, like I said, my experience was really impactful knowing who those team members were, how I could reach out to them by email, and then, if you see something, you say something, and just really working by that principle. If you'll go on the next slide, please. So just some other things that to highlight is really looking at data. So that's one of the elements that I really partner with my quality directors now on, is looking at all this key data, because our healthcare organization is very much data driven. So I surveyed my colleagues, my other case management colleagues, in preparation for being able to talk with you, because not every one person is made the same, and different people have had varying experiences that I wanted to bring back to this group. And some of them really spoke to relying on their quality director to pull data, especially those who might be younger in their career, and to get in, roll up their sleeves next to their quality director and really dig into what that data is telling them about their readmissions or their top emergency room utilizers, or the patients who continue to come back, or, why is this one particular disease process driving your readmissions issue? And oh yes, it's also your highest DRG for length of stay. So my encouragement would be to, if that's not your skill set, that's okay. Partner with your care management director or lead, ask how they get their data, learn and collaborate together, because I feel that one of you will have the strength that the other one needs to build, and you'll be able to really help each other, and that will form your collaboration and strengthen your partnerships.